All right, everybody, welcome back to the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott. With me here today in person, we have Dr. Keith Rode. He traveled all the way from South Dakota and Iowa, right on the border there, to come do this podcast because it took me 8 months to hunt you down and get you in for it. He's not great at answering his phone sometimes. But anyways, Keith is someone that I've truly looked up to as a clinician. He is one of the key opinion leaders in the newest area of shockwave therapy. And we just watched you give a phenomenal speech today about all the things you're doing in the world with multiple sclerosis.
Yep.
And highly trained manual therapist as well. You own a clinic and a gym out there, or two clinics?
Two clinics, yeah.
Two clinics.
Yep.
And we wanted to have you come on today to talk all about the benefits of shockwave, the stats about it, what the new literature is saying, and we'll just pick your brain on all that. So thanks for coming here. And what actually got you into shockwave in the first place?
So, that's a great story. And, one of it honestly comes down to, I had never heard of it when I was first introduced to it. And I had a patient that came in, they drove from over like an hour away to come see me in a small town, Iowa. So I have my two clinics. I live in South Dakota, like you said, but my practices are in Sioux City and in Akron, Iowa. And Akron's like a small town of like 2,000 people, right? Very, very small, very rural area. I had an individual that came over from like an hour away to do a discovery visit with me. They had a case of a chronic patellar tendonitis issue. They had done a 10X procedure. They'd done rehab with it. It wasn't getting any better. If anything, it was getting worse. And then their other knee was having the same issues. They're starting to have the same issues. And so they were really kind of looking at a desperation from a standpoint of like, is there anything, we've heard good things about you. Is there anything that you can do to help, that you could do to help in this case? The individual is a high school senior. He was taking 12 ibuprofen in one setting just so he could practice.
Jesus.
In run. Like he's overdosing on ibuprofen just so he can participate in sports. Football playoffs were coming up and all that stuff. And I'm just like, holy cow, this is a big problem. Because this kid's liver is not going to continue to withstand that amount of dosage. But there's a huge, huge issue here. And so we got through the examination and answered questions. And his mom wasn't able to be there at the session with him, but she had a list of questions that she would like answered and ask. And so we went through the list of questions, and on the bottom of the sheet of paper, it just had the four letters ESWT with a question mark. And I was like, what is this? And so I asked the kid, I was like, what's this mean? And he goes, I don't know. My mom just wrote it on there and asked me to ask it. I said, okay. And so, I did what any good person would do in that circumstance when you don't know what something is. You pull up Google and you type in the question in the search bar. And in the top of the page of the search from the Google search was a description from the Mayo Clinic. So the Mayo Clinic page showed up talking about shockwave therapy, what it was, what the benefits are, what conditions it treats, and things of that nature. And I was like, I've never heard of this. Oh my gosh, what is this? And so I started reading. I'm like, this is really interesting. And so that just intrigued me, because then the more I started to read about it, I was really fascinated just off of that one page. And then, so I just started looking more and more into it. And the more that I read about it, the more excited I got. Because if you're like me, those individuals who you're not able to help, you kind of feel like you failed them. Mm-hmm. You hold on to them. And so like, I tell people I have like this graveyard in the back of my brain, cataloged somewhere on my failures, or what we deem as failures, even though everybody has limitations. Every profession has limitations, but inherently, thanks. This is right in my face here.
Yeah.
But inherently, maybe if we do
You don't have to keep looking at me.
Okay. But inherently, like when we're seeing somebody, we want to help them. We want them to do well. When we can't help them, then it kind of stings, just because we just so want to help the person. And so you start just thinking about, I wonder if this could have helped this person, or could it have helped that person? Maybe they wouldn't have had to have that surgery, or they wouldn't have had to have whatever this or that done to them. And so I started looking at it from a standpoint of like, gosh, is this a technology that we could bring in? I've never heard of this. This is fairly new from the standpoint of like in our region in the Midwest, doesn't exist really, right? And is this something that we could bring in that it could be a beacon of hope for some of those individuals? But more importantly, could we maybe help some of those tough conditions or cases and prevent those surgeries from happening or whatever the case may be, And so that's where it all started. That's the genesis. And then I just got more excited. I did about 3 months of obsessive research on it into the field. And I was like, okay, I want to do this. Let's go. So that's how I got into shockwave therapy.
And, I mean, it's amazing. I got into it kind of a little bit different. I was at a conference. Actually, you were at the same conference, and Brendan from Cura Medics was there, and it was like, we have this device. I didn't know what Shockwave was at all. I was like, he's just selling another ultrasound machine like this, whatever. I wasn't even paying attention. And then I went to lunch, and all these guys were talking about how awesome this device was. And I was like, yeah, these guys, I don't know what they're doing. Let me go to sit at this other table and see what these other guys are talking about at lunch. Talk shop, and all these other guys are talking about it. And we went back from lunch, and it was like, oh, this woman got up on stage from the UK and gave a big shout out to the company of how much this device has changed their practice. Like, all right, this guy's from Rhode Island. Let me go talk to him. And it had a really bad tendinopathy for like a year from being a weightlifter, a drummer, a manual therapist, whatever. And like, it hurt to drive because just grabbing the steering wheel hurt my elbow so bad. He did 8 minutes of treatment on me. And I, for the first time in a year, could do a pull-up pain-free and could not recreate any symptoms for like 3 weeks.
Yeah.
But I could just make a fist before, and that would like irritate my symptoms.
Yeah.
I was like, okay, there's something to this. And then I started looking at the research. I was like, oh, this is actually like a very powerful tool and has a lot of promise behind it. So let's get into a little bit of that. So with your professional trainings and research and everything, what are the key benefits that Shockwave and, or what is between Shockwave and EMTT, what is Shockwave and what is it doing?
Okay, yeah. So, I mean, what Shockwave basically is doing is it's basically trying to just nudge your body that's stuck. If we want to just keep it really simple, right? Now, obviously, there's a lot of physiologic and $20 words we can throw out there as far as what's happening. But what it does is it helps unstick or unstuck your body that's stuck in this chronic pain, chronic inflammatory process to allow a natural, healthy healing process to occur. And it works fantastically for chronic pain conditions, especially degenerative conditions, because the body, just for whatever reason, it's stalled and it's just kind of stuck in this phase where the tissue is not able to heal. It's kind of just stalled out, and then you just live with this life in pain. So it kind of helps restart that healing process and get the body unstuck. But the other thing that this is really, really, really great with is acute injuries. It basically helps warp speed, despite I've seen what some individuals have said out there about acute injuries. Like, oh, I wouldn't do it in an acute injury. I'm like, bullshit, because my ankle sprains are back in like 2.5 weeks. Like full bore.
Have you come in right away as soon as this happens?
Yeah, it's insane.
Yeah.
It is insane. I've had high ankles back in 3 weeks before playing football without any deficit. Like, you see a high ankle sprain that usually is a 12 or a 6 to 12 week injury. When that happens. I watch the NFL when there's like a high ankle sprain or high level college. I'm like, get Focus Shockwave and EMTT on them right now and get going with it. If you do that, you can really warp speed the healing process and cut down that time and get the return to play much faster. Physiology and biology still has to happen. Yes, we know this, but as far as the acute, when people are looking at long-term outcomes and things of that nature, 6-month outcomes, 4-month outcomes, 12-month outcomes, probably the same. The body's going to eventually heal in some cases, like these acute injuries. But if you're dealing with an in-season athlete or somebody who just doesn't want to be in pain, do you want this to take 6 or 8 weeks or 10 weeks, or do you want to be done in 4 or 6 or 3? Your choice. Do you want the Disney Fast Pass, or do you want to stay in line all day long with everybody else?
That's a good analogy.
Yeah.
And also just too, like with that, like you can get back to training for all my strength athletes and stuff. You can get back to training at a much faster rate and be able to tolerate more load and not be sacrificing like that loss of fitness and conditioning while you're rehabbing it, and you're not going to create the irritation that you would without it. And you're just going to like all along move faster through rehab.
Yeah. And I think there's something to be said there. And there's obviously a lot of current research that's going into that performance realm and recovery realm of things that's ongoing. But what I've witnessed, from an anecdotal standpoint or from a clinical standpoint, is absolutely it does. If you think about the mechanism of what Shockwave is doing, I know we stay pretty high level with it, but if we're talking about
so talk about the mechanisms a little bit too. Of like we can talk about stem cells, the vascularization, the anti-inflammatory effects it has. So touch on those a little bit.
So when Shockwave starts off, what it's doing is it's producing a controlled, healthy inflammatory response. Okay, now usually when there's a tissue injury, there's inflammation that happens, right? That's part of the natural healing process. You get a pro-inflammatory. That's why things might swell up a little bit, and then the natural sequence of things is turned into an anti-inflammatory effect. You got release all these cytokines and other physiologic factors as well. But what Shockwave does is it will help stimulate that or begin that process. Now, people are like, well, isn't that bad? Is it going to be painful? No, it's not. It's actually really quite tolerable. And it's just kick-starting that process. It's going to accelerate as far as your ability to get to that anti-inflammatory effect. It's going to increase the amount of growth factors in the area, which is going to help with the tissue building and remodeling. It's going to increase the amount of blood vessels that are in the space. So you get angiogenesis, you got neovascularization that occurs, you got vessel endothelial growth factor that's happening, right? So all these physiologic factors are occurring in this space and time. And the thing that's really cool about it is, once we start stimulating the body, we get through our sequence and series, this is going to keep working for the next several months. So typically at least minimum 90 days or 3 months, this is going to keep working. So when somebody gets Shockwave therapy, really they're going to really know the ultimate benefit is going to be realized at that 3 months. Now they might have benefit way before then. They typically do, right? But it's the beautiful thing is like once we get done through with it, it keeps working in the body. And it's just awesome to see that. And to touch on the growth factor aspect, I know that you use a lot of high-end techniques in your clinic, and you guys use blood flow restriction therapy and things of that nature, and you're talking about Shockwave and improving performance and getting the athletes to be able to load more and get back to activities. Yeah, it makes sense, right? If I'm doing Shockwave over an area of the body and I'm stimulating this physiologic process to basically repair tissue and heal it, but part of that is recruiting a crap load of growth factors and activating your body's natural stem cells in this space, how can it not but help get stronger? If you're doing blood flow restriction therapy, you're getting stronger. Well, you're an expert in blood flow restriction therapy, but you get an increase, growth factors via hypoxia, right? In essence. Yeah. So if we're doing that, we're flooding this area with all these growth factors. Why wouldn't the tissues help but get stronger? Yeah. So it makes perfect sense that happens.
It's, I used to think of rehab before all these technologies. It was like, all right, how do we, treat the tissue from a mechanical standpoint? Now it's like, what cocktail am I creating? Like, it was like very much a physical rehab type thing. Now it's like, we're talking about biology and like, what cocktail am I creating from, between like what we look at from like, even like spinal manipulation and all the neurotransmitters, and then looking at, what is Shockwave doing? And we have stem cells differentiating and the growth factors and the vascularization plus the blood flow and the IGF. And it's like, and then with EMTT paired on that with the ion transport chain, or the cell permeability changing based on the electrical voltage. It's really cool what we as PTs can do now.
Yeah. And that's what I get so excited about with this, is because this is like the first time in our profession. I mean, really we're practicing medicine is what this is, but this is the first time we can actually get like deep into the body and affect real change at a cellular level, right? We're changing the physiology of what's happening here. And that's such a cool and powerful tool to be able to have. But the awesome thing is it's completely non-invasive. That everything's from outside the body, and there's really little to no downside of it. Outside of transient soreness, That's about the only side effects you're going to get with this stuff. Otherwise, it's pretty much good for most any kind of pain or limitation or whatever that you might be having.
Yeah, people ask, they're like, well, what wouldn't you use this for? I'm like, almost nothing. Like the thing today we went to, it's like there's more and more of we're using this with scars. Like Allison was talking about using it for fertility, Parkinson's disease, dementia. You're using it with MS patients. I have a possible MS patient I'm using it with now. All the orthopedic and sports rehab, and then we're talking about like just even performance recovery for sport. Yeah, and using it as a maintenance tool to not have drops in performance through long bouts of training. That's pretty wild. All the things you can do. So, there really are no side effects to it either, which is like the best part of it. Yeah,
it's a very, very safe technology, and that's what's so amazing because the upside is so great. There's very little to no downside, and if it doesn't work, it doesn't work. But there's no harm to it. Like you're not going to be injured or hurt because of it. And there's an 82% success rate on the whole with it, which is really freaking good odds.
How do they define that success rate too? Someone was asking me that. My friend Corey was asking me that today.
I think it really comes down to patient outcomes. Who has seen a meaningful change, and patient satisfaction is really where that comes from. A lot of the literature, though, if you dive into that, I think plantar fasciitis is one of the most heavily researched things. That and Achilles, calcific tendonitis, the shoulder. Plantar fascia, I believe, is probably around 90 to 91% effective. Really freaking good. Really, really, really amazing. And it is solid with plantar fasciitis. It's like if I got somebody who's coming with plantar fasciitis, I'm like, listen, we're going to do this. Like it's always their choice, but like, I really, really highly recommend you do this. I'm on average probably 4 to 5 treatments and they're virtually pain free. We can crack on for the next 3 months and dealing with this terrible pain in the foot if you want, or we can be done in the next 4 weeks. It's up to you. What would you like to do? It's that so powerful and effective that I feel that confident with it. And Achilles, I think, is like 89 or 90% as well too. So like there are really high success rates in some of those pathologies. And other ones that's where we don't maybe see quite as much success, I think could be due to maybe a lack of study sizes as well too, because there's not always a lot of research in some of those things. I mean, you as you get a larger body of evidence, obviously your N number gets bigger, so you have more data to pull from a statistical standpoint. But I look at it from the standpoint of, and maybe this is super simplistic, but honestly, like we're all, it's muscles, tendons, and cells, and bones, and joints, and things of that nature. And as long as I know what the problem is here, how can I think through the problem, and as far as how I can deliver the energy to manipulate the environment in a positive change for this patient that's here. I mean, because let's be honest, there's not a ton of research articles out on the abductor digiti minimi muscle or tendon, if that's even a thing, right? I mean, that's a real muscle, but like, if insert diagnoses here, like, well, there's no evidence on this diagnosis. Well, yeah, there's probably not a large cohort that's out there, people that are really studying this specific thing, but that doesn't necessarily mean that this won't work for it.
And and one of the conferences we went to, it was like, it cost us $3.5 million to get this FDA approved just for plantar fasciitis and Achilles tendinopathy. So it's like, we've proved it's effective. And like, for anyone that doesn't know, did you get to dissect cadavers in school? Yeah. The plantar fascia is one of the most resilient things. Like, I think I went through multiple scalpels trying to cut through it. It is a very,
it's tough.
Resilient structure. And so if you can prove if you can prove that you can improve that, you could definitely improve muscle. It's like, so they chose the hardest thing to prove, but it's like, oh, there's no evidence for this. And finally I had a doctor the other day that I have someone with something going on with their hand, and they're like, well, there's not much Shockwave data on the hand. It's like, yeah, but it probably still work. And like, worst comes to worst, it doesn't. And like we were talking about at the conference this weekend, was worst comes to worst. Like, if you're getting Shockwave and like the next thing for you is surgery, if this doesn't give you the outcome you want, you're that much better prepped for surgery, where you have these stem cells floating around to help heal tissue, to decrease the inflammation in the air. So like when you have that surgical outcome, you're going to be much better in your post-surgical case. Like I had a woman even the other day, or not the other day, a couple months ago, I'm still working with her, but she had her hip replaced. And before I was working with her preoperatively and asked the surgeon, or had her ask the surgeon where he was going to do his incision. And we shockwaved that whole area.
Yep.
And he ended up, so he gave her like a 6-inch margin of where he was going to cut. And so we shockwaved that whole area, and he ended up, but then he ended up cutting only half of that and went like 3 inches further down. But what was really interesting is
the difference in the scar.
4 weeks later, she's like, why is my scar so good on like the upper half and then not the lower? I was like, we didn't shockwave that lower half because he told us he was going to do up here, and he changed his mind last minute and went lower. She's like, oh my God, that's so cool.
Yeah.
So then she had to have the other side done, and we totally did that whole area, and it healed much better.
Yeah. Paul Holbrook spoke this weekend. He's a physio from the UK. He was over. Yeah. And he was talking about an image from an abdominal,
I show that to all my patients.
Yeah. I think that was, I think Dr. Carson Knobloch, I think that might be one of his patients where he did on one side, they had a tummy tuck or something like that was going to be done. I can't remember exactly what
I think it was a hysterectomy.
Or hysterectomy, yeah. And so they'd done the one side and then the other side, and the scars look completely different. The side that did the shockwave on looks absolutely pristine, looks fantastic.
Yeah.
But to your point, even if we're doing shockwave in an effort to prevent a surgery or to to preserve a joint or whatever the case may be, tendon, heal that without having a surgical intervention, even if we don't get the outcome, which is avoiding that surgery, it's a no lose proposition because we just fertilized the land. Basically, we activated all the cells in the area, and so when the doctor goes in there and does his surgery, the post-surgical outcomes are going to be significantly better because everything's been prepped, and the doctor's going to have a better, and you're going to have a better post-operative outcome because of it. Finally,
she laid down. Sorry, my dogs are in here, and one's very anxious right now. But yeah, the surgical outcomes using shockwave preoperatively, even like I try to tell everyone, I'm like, please just come in and do even like one session before you go in for your surgery.
Yep.
Like I'm going in for surgery, I will be doing a whole plan of care of shockwave before I go in for that surgery.
Yep.
With the EMTT, no doubt. And then as far as the EMTT goes, this is a newer technology. Like no one knows about EMTT still.
Yeah. So I actually fun fact, I have 2 of the first 100 units in the entire country.
Oh, really?
Mm-hmm.
Okay.
So it just came over to the States in 2021. It's been in Europe since
I got in mine in 22, so I probably have one of the first, like, how many people were in that room today? I was like thinking, I'm like, how many people have this device?
Yeah.
So I probably have one of the first 200-300 maybe.
It's been here for 4 years now, but it's still quite rare. Like, to have the whole suite of Storz products, if you will, if you're talking about radio pressure wave, focus shockwave, and EMTT, like there aren't very many places that have it. So Dr. Elizabeth Bondi, she's a podiatrist at the Mayo Clinic, and I know her, and I was consulting with her actually a few weeks back about a patient who lives up around the Rochester, Minnesota area, because I was looking, hey, who around there? The podiatry clinic group, I know that they got it because I know that she, worked with Mayo to get that in there. The sports medicine docs have it in there. I'm like, do you guys have all 3? And she said, no, they just had the radial and the focused. They're trying to get EMTT in the Mayo, but they don't have it yet, which just kind of blew my mind for a second. It took me back because I'm like, I got 2 full stacks, and I'm this little peon, right? I got a full stack in each one of my clinics. But from a regional standpoint, we're really like one of the only places in the entire region in that Midwest. When you talk about Sioux City, Sioux Falls, I don't know if any clinic has one. Mayo Clinic didn't have one. I think maybe Minneapolis does. Des Moines would be the next closest place. Omaha, questionable. I don't know if they really do have the full suite, but like that's a large area geographically. Yeah. And there's a lot of people in that area too. I mean, it's not as populated as the East Coast here, but still, like, it just kind of struck me like, holy cow, like how special and unique that machine, but having all of those are.
Yeah.
And I tell you what, the transformations that the EMTT does is quite insane. When we're looking at, it's like the silent sleeper in the background. You don't necessarily,
because you don't feel it.
You don't feel it, and you don't feel it. And the reason why you don't feel it is because the frequencies are so fast. It's the velocity which the energy is transmitted in there, right?
Really?
So like it was talked about this weekend a little bit, as far as how rapid per milliseconds, how many pulses are actually going on. So it's too fast for your body even to be able to pick up and detect, and that's why oftentimes you don't feel it. Okay.
Even if you slow down the frequency?
Yeah. Well, that's that frequency aspect is only the speed of how many pulses per second is going. But I'm talking about the frequency of the actual impulse itself is going by, right? So it hits the cell wall at, gosh, and I can't remember what the slide said. It was like maybe 70 times per 7 or 0.7 microseconds or something. It was stupid fast. It was so fast, right? But that's why the differentiation between that and PEMF as well too.
Yeah.
And then that and MRI. MRI is 1 point whatever Tesla strength, right? When you go in there, but there's no therapeutic effect because of the velocity at which the waveform is interacting with the body, that it can't manipulate those ion channels. And that's a special thing about the EMTT is the velocity and the repeatability as far as how that oscillates in there. It's able to open those ion channels so you get an exchange of electrons, and then that helps reduce the inflammation, but then basically try to reset the cell or get it to be open to regeneration and change. So that's where you see long lasting and real change with it. And then some of the, obviously the later studies that have been coming out here recently, especially by Gertesmeyer, Lennart Gertesmeyer, Dr. Luger Gertesmeyer's son, Lennart, is a physician as well too. But he has a great study he came out with, and I think in November of 24, on showcasing and highlighting the effects on bone. So increasing bone mineralization and gene expression and calcium flux and things of that nature. And so really, really cool stuff when you see what it's actually doing. You hear about, it's developed for the treatment of degenerative joint diseases and disc diseases and all these arthritic kind of things and yada, yada, yada. But really, if you think about it, it's the ultimate tool to help reduce inflammation. And then basically it's like hitting the reset button on the cell. And so that really pairs super great with shockwave therapy because of that. You can do the EMTT, basically get the bad inflammatory process down, right? And then try to prep the cell and reset it, so to speak. And now it's ready to be accepted for the shockwave therapy, which can cause the larger regenerative change for it. So there's a great 1-2 combination.
The other thing I've heard too before is that you can think of EMTT of like a battery in a car is starting to die. Like a cell basically, when it is chronically inflamed, it basically gets fatigued and stops working right. And this is EMTT is a way to reboot that energy system.
Yep.
And what's really cool about them is EMTT, shockwave have the same effects really for the most part.
They can. Roundabout way. I mean, they work differently. The
mechanism is different.
Mechanism is different. So EMTT's electroporation is the chief mechanism there.
Yeah.
But the shockwave is mechanotransduction.
That's where I was going. It's like they have similar benefits, but the way you're getting to that is a different pathway.
Yep.
So it's a very synergistic effect when you put the two of them together.
Yes, and we've seen this grow obviously in the musculoskeletal field, in your basic orthopedic problems. Obviously the origin, as we know, it comes from treating kidney stones via lithotripsy back, in the late 70s, early 80s. That's where the origin of shockwave comes. And it was in the 90s when they really started, or late 80s, 90s, when they started to really go into orthopedic. And that was because they discovered that with the lithotripsy, to the kidney stones, they were starting to see morphic bone changes in the pelvis, because you got to shoot through the pelvis, that beam up in there to get into the thing. So they're seeing bone changes. And so they're like, oh, what's going on here? And so that's what spurred the whole investigation into the orthopedic realm of things. But it's grown so much, as you mentioned, we touched on with scars, incisions, even treating the skin before, the surgery's done or before you're getting cut. But we see that expand into urology. Obviously, it's there. Dermatology, cardiology now. Yep. Doing stuff in the heart with it. It's in orthopedics. And then obviously neurology, which, I have some discoveries that we found with multiple sclerosis. But most importantly, what they're seeing over in Europe. And then there's a study at Harvard right now, too, with the Neurolith, which is a transcranial pulse stimulator, investigating, Parkinson's.
That thing's crazy too.
And then Alzheimer's over in Europe. They're really doing a lot of good stuff with Alzheimer's disease. It's really, really fascinating.
Yeah. And What was I going to say? There's just so much to talk about with this stuff.
It's the neurology aspect of things is
so talk
whole
about
new game.
Tell us about your patient you started with that had MS, because that's part of what got me bought into focus technology too, is when I talked to you, because I was like, hey, I came to Keith, was like, do I do radial or focused? And I think that's a conversation I want to have too, of like, let's start there, actually.
Okay.
The wild, wild west of Shockwave therapy right now.
There's proven conditions, right? And, where we know it's going to work for sure. And then you got, things that you really look at the ISMST, which is the International Society guidelines, and you get into some of the experimental realms.
Not even that.
Off-roading.
I'm talking about
so backwards.
I'm talking about the fact that, so I just made a post the other day, like Shockwave right now. What I really respect about Keith too, is that he is one of the key opinion leaders. He's a super smart dude. And he also, is on the council, right? Or the advisory board for this new Shockwave thing, correct? Am I wrong in saying that?
I don't know if that's...
Haven't they just created like a council for it? No?
No, I don't think so. No, I don't know.
The ASWT.
Oh, the ASMST, that's just the American Society.
Yeah, the society.
So I'm not on the board with the ASMST right now.
Okay.
I will be speaking at the meeting though in March.
Okay.
So that'll be in Boston. So if you're into this technology, you want to come by and listen to a bunch of smart people from across the country.
Yeah.
Yeah. And so like the ISMST is the International Society.
Yes.
Right. And I was down in Bogota. That's where they had the World Congress meeting this last spring or last September. So I did go down there. There was a good contingent of Americans, but the ASMST is the American Society that's just started up, and so it's exciting to see it push this forward.
What I was going to say though is there's no regulations on this stuff right now. It's the Wild West of, like, I went to a stem cell clinic here in Mass, and they are a regenerative clinic. I told them, I was like, oh, we do Shockwave, and they're like, oh, we do Shockwave too. I was like, oh, do you do radial or focus? They're like, we don't. What are you talking about? Like, what is the difference? And I was like, what? And like, you don't know the difference? I was like, well, where's your device? Like, oh, it's in the drawer. I was like, in a drawer? I was like, what? I was like, and they pull out this wand, and I was like, where did you guys get this? Like, Amazon. And so you can buy a device for $1,200 on Amazon, or you can spend $50,000. All right, excuse us, everyone. The dogs are barking. Keith's breaking microphones.
I'm trying to figure this out for more comfortable.
Yeah. But you can buy one on Amazon. People call radial Shockwave, but it's not truly Shockwave.
No.
It is a radial pressure wave. It's different.
Wave. Yep. The physics are completely different.
And then a lot of people don't have any training on it either. They're just buying these devices. I'm not going to be shy away here. The company StemWave, like, just gave one to my colleague that's owns a gym because they're not FDA regulated.
Yeah. So, I mean,
and so this is the thing, like, people are like, oh, the fear I have about Shockwave. And I just made a social media post about this the other day where I dressed Connor up as a construction worker on AI. They, oh God.
Uh-oh. Oh God. Oh God. I have to clip this one.
No, we're getting the dogs out.
Who let the dogs out? Baja man. I can do. This is way better if I do this, I think.
Okay.
Maybe that's still better. But it's not like just right in my face ish.
All right, excuse the brief interruption there with the dogs. Anyways, as we were saying, so yeah, and then like I see people just butchering the treatment. Oh yeah.
Yeah, I mean, so that's a very good point you're bringing up. That's something has been a concern from a lot of us, in the scientific realm, and people that are doing this the right way, and it's almost a responsibility to try to steward this, because to your point, it's kind of turning into the wild, wild west, and that's one of the reasons why we created the pains protocol with the Institute of Tissue Regeneration Repairs, because we're seeing what's playing out in real time. It's like, fuck, you got this person doing that and that person's doing this. And like, it's all over the place. And like the fear is like, we know that this stuff works. We know that it's absolutely amazing. But if people aren't doing it the right way and applying it properly, or even know what the heck they're doing with it, it's going to get a better rap. You know, and then somebody's going to get Shockwave and they're like, oh, it didn't work. Like, well, no, it's not that Shockwave didn't work. It's just you didn't have the right thing done to you, you know? And so there's a lot of different tangents I can go off with this. Okay. Yeah. And it does kind of fire me up and burns my bones a bit because it pisses me off because you go on social media and you see these people that are
butchering treatment.
Places like, what the hell are you doing? You're going way too fast. And so you're just spraying shit all over the place. You have no idea where you're going and where you're targeting with it. You need to slow it the heck down so you have an actual chance for the energy to absorb into the tissue and go to where you want it versus just bouncing over the heck. You know,
you can swear on here.
Yeah. I'm kind of trying to be a little reserved a little bit, but like it is irritating when you see it as a provider, but we have to try to get a hold of it and like try to teach people. That's why the educational things are coming out. That's why I do one-on-one consulting as well with individuals, and, you know, where clinics bring me in and I help onboard them and their staff on what this stuff actually does so they understand and appreciate it. Number one, I think you have to have an appreciation and understanding and appreciation for it. But then number two, how do I actually use it? You know, because if you don't know how to use the tool that's in your toolbox, you're not going to get the outcome that you're wanting to get with it, you know?
Yep.
And that's the biggest mistake that I see is from a lot of people out there don't actually truly understand the technology and what it's supposed to do, the physics and the biologic effects with it. They don't understand how to apply it appropriately with techniques. And then because technique does matter, despite what a lot of people just say, it's a point and shoot and blah, blah, blah. It's like, that's bullshit. Especially if you got focused, you got to be precise and accurate. You cannot just spray that shit or point wherever the fuck you want and just get right on top of it and, it should be hitting it. Like, no, there are subtle little changes in angulation and where you need to get your target tissue, then also depth, and then knowing the energy levels. You know, what is your target tissue? Okay. How do I adjust the applicator tips on my machine or the depth, you know, with the focus to get to where I want to get to? But then what's the appropriate energy level I need to even get to for that type of tissue? Because nerve tissues respond differently, as do skin, then muscle and tendon, as do bone, right? They all need different levels of energy to actually respond. If I'm just treating bone with 0.10 millijoules,
we're never getting there.
I ain't going to do shit with it. You know, so like you have to understand the strengths and limitations, and then also the differences to machines where you got a focus device and then versus a radial device. They both do different things, right? And so different energy levels are measured in bar pressure on one end and in millijoules of milliliters squared on the other end. So, like, there's a lot to know about that. But the other most important thing with that is like not just knowing what the machine does, how it interacts with the body, how to actually apply it, but then the other most important thing is how do I talk to my patient about this and set the appropriate expectations? Because you get people that don't know what the fuck they're doing with it, and they're just doing whatever, and then like the patient's not feeling a whole lot of different after 1 or 2 or 3 sessions because this dipshit didn't know what the fuck they were talking about and promised them the moon.
There we go. There's the swear.
There we go. Yep. And promised them the moon, and the moon didn't come because they were doing everything wrong in the first place. Oh, Shockwave doesn't work.
Yep.
No, it's not the Shockwave didn't work. God forbid. You know, it's not the machine's fault. Yeah. The reason why the damn thing didn't work is probably the person that was freaking applied in the first place.
Yep.
God forbid we look at ourselves and say like, oh shit, maybe I got the wrong diagnosis, or maybe I'm not doing this right. Maybe I'm not applying it in the right place. Maybe I'm not shooting in the right space.
Yeah.
God forbid I look at myself. Must be the machine. Oh, the machine don't work. Oh, that's bullshit. Machines work. Well, most machines work.
Yeah.
The $1,200 Shockwave on Amazon probably ain't worth shit. But, you know, to my point, I'm getting a little worked up here, aren't I?
There we go. I love it. I love it.
Point. Like, I'm so passionate about this because it does so much wonderful things. But then, to your point, you see so many people out there that are not doing it properly. Just like, oh my gosh.
Yep.
And it's just frustrating as all get up because it hurts us. It hurts the science because you saw what I did today on stage in the presentation.
Yeah.
And you would never ever believe that if you saw it. You know, if I just told you the story without seeing the video, you're like, yeah, right, whatever.
Yeah.
You did this treatment. This person could barely move their leg. They damn near fell over. You had to kick the leg out in front of the system to walk 25 feet. And then you're telling me an hour later or so that they're walking on their own unassisted and it looks like there's no problem. Somebody with a neurological condition like MS, and then 3 weeks later, they're jogging 25 feet in 3 point whatever seconds when it took them 85 seconds 3 weeks ago.
Yeah.
Like, there's real stuff that's going on with this, is real change. And, you know, that's what I'm so excited about the future with, you know, getting our information and getting hopefully the case series published, you know, so we can start to go into a larger cohort study with this. And because I don't think it applies just to MS, you know, I think there's a wider range of neurodegenerative diseases, but, you know, we see what's already happening with Alzheimer's, with the neurolith, Parkinson's, and all these types of things. And so it's a really promising future from that aspect. But to circle back, you got to know what the hell you're doing. You got to have the right devices, the right machines, the right technology, and you got to be somebody who's competent to understand what's happening and how to actually apply it.
Absolutely. And so let's go into those cases you have with those MS patients. So you told me about this a couple of years ago. You had your woman that came in. I think she had facial droop. She had tinnitus, loss of vision on that side.
No, the vision was okay there. She just didn't have good vision in general. She had these thick level 10 prism glasses, like Coke bottle glasses, right? Yeah. Like really thick glasses. Mm-hmm. Yeah.
And then she came in to get Shockwave, and I think you said you called the physician too, because you're like, the Shockwave on an MS patient? Like, I've never done this.
Nope. So that wasn't how this happened. So I can't get into too much of the details here, just because of the sensitivities of what we're doing and from a legal standpoint. But you know, the individual came in. She was supposed to have a surgery, and the doctor wanted to operate on her. She didn't want to have surgery, so we were seeing her for an orthopedic condition, really. And so we applied Shockwave because we had good success with trying to get some of the muscles and the tone to reduce in the extremity that she was having the radiculopathy in, right? And so I'm like, okay, you've done well with the A-stem, you've done well with some cupping stuff. Let's do Shockwave here, okay? And so we applied the Shockwave. I'm not going to get into deep details as far as where I did it and how I did it, but it was an amazing response because she came back in 2 days later, and you know, this is the thing that gives you the goosebumps, right? It's like she comes in, she's super high energy, and she says, "You'll never believe what you did to me." And I just go, "What?" You know, and I had a feeling it was good because of how like energetic she was. Different place, different person, you know, mentally, and she's in a different place than where she was when I saw her 2 days ago. And I just go, "What's that?" And she goes, "You gave me my smile back." I go, "What?" "Look, you gave me my smile." And she goes, she smiled for me.
Yeah. Where before she couldn't, she had a droop on that side. She couldn't.
Right side of facial droop. She goes, "This is the first time I've been able to smile in 3 years." Mm-hmm. Like, I just stared in front of the mirror last night for like 3 hours straight because I haven't been able to see myself smile. And I'm like, holy shit, you know? And it's just like one of those moments where as a provider, you just get the goosebumps. I like literally had chills and the goosebumps, the hair standing up on my arms. I'm like, okay. And she's like, "Oh yeah, check this out." And then she starts rattling off all the things that she can do now that she hasn't been able to do. I'm like, hold on a second. So I'm like starting to type notes and document everything that's going on. And it was just like, holy cow. And so she's somebody that didn't have really good trunk control either. Her coordination was bad. She's like 60% accurate with an upper extremity coordination examination. That resolved 100%. You know, just her gait speed, quality, everything was so much improved. And then we come to find out the next week where she saw the eye doctor before her EMTT appointment because we didn't have the EMTT in the Akron location or that first location at this point. It was just in the Sioux City. And she goes, "Yeah, you'll never believe this." I'm like, "Oh yeah? What else?" You know, because I can't believe what happened already. And she said, "I just had my eye examination." So the eye doctor can't believe it. It's like, "I have no problems. Like I have level 1, like I can see without glasses fine now." Or she had like these big thick glasses before. She said, "I could see perfectly fine now." I'm like, that's insane. Mm-hmm. So like there was just this immediate just neurophysiologic, you know, and what we're hypothesizing, one of the mechanistic hypotheses is there's a supraspinal effect that's happening here. That it's really seems to be a systemic change. So just about every type of symptom somebody with MS is having, it's being affected in a positive direction. So that's really mind-blowing and really quite insane and exciting.
Yeah.
But I can't get into more details than that, but it's just stuff that's really cool to have been able to witness and see. We're working on getting the publication out there, but I think it could be a big game changer.
Yeah, and you showed us some videos today at the conference, and it was really cool to actually see what you've been doing, or not what you've been doing, but how these patients have changed.
Yeah.
Drastically in a very short amount of time.
Yeah.
Especially that woman that literally, I don't even think you had a gait belt on her.
No.
But we see the footage of Keith trying to get this woman to walk 25 feet, and he's holding her, literally having to kick her leg for her to get her to ambulate
to the finish line.
The finish line, because you're just in the middle of a gym too. Like, it was either that or fall on the floor.
Yeah.
And how long did that first one take?
85 seconds.
85 seconds.
Yep.
So over a minute to walk 25 feet. And then,
3 weeks later, she's jogging.
3 weeks later, she literally jogged.
Like 3.45 seconds or something like that.
Yeah, she did 25 feet in 3.5 seconds. So I don't know what percent change that is, but it's probably it's over 1,000% better. Which for someone that can't walk and do just the basic, ambulatory things, that is the biggest game changer you could ever give someone. And you didn't use drugs.
Nope.
You didn't use anything except we literally basically injected her with energy from a superficial standpoint over the skin. And it took 5 minutes, 10 minutes to do.
Yeah. So it was really quite transformational. And, the important thing though, and this is where it's always rooted for me, is helping people, but the awesome thing is just her expression. Yeah. In that video, and the joy, and she started crying because she was so happy. She couldn't believe it, and it was, and that's what we do things for. And it has to be rooted in good there. And you see, the one thing that I get frustrated with, you see with some of the ads out there, you probably get your feeds, social media feeds flooded with ads. It's all about fucking prices and dollars and revenue for the clinic. Well, that's important. It is important because it is high level technology, but it's important to support the practice, be able to offer these technology, so you can continue to help people and things of that nature. But that's not where it should be rooted in. If you're getting Shockwave, you shouldn't be getting it just so I can make more money. You should be doing it because I can help change lives. I can help people avoid surgeries. I can help them, live a better, healthier life, or not be in as much pain as they are in a day-to-day basis. Or maybe we get them off these pain pills, and because they're on pain pills, they're probably on antidepressants. And because they're on antidepressants, probably on anti-anxiety meds and all these other things that are happening, right? So we could start taking these medications away from them and then actually let them enjoy their life. That's where it really should be rooted in. And if you do that, then you do the right thing, the financial stuff and whatever else, it takes care of itself. But I think if you do it for the good reasons, the right reasons, the most important thing what you do is you build up your bank and your soul. And I think that's the most important thing, is that you can't put a dollar amount on that. Yeah. That is priceless.
Yeah, especially too when this has definitely helped people stave off surgeries, injections. It gives people hope too. Yeah. The guy, I had a physical therapist come to me the other day that literally had no strength in his tricep or his wrist extension for the past 4 years. That we don't know if it's MS or if it's something to do with his, his spinal canal and things of that nature. But he's tried everything, and he came to us. He was like, I heard the Shockwave thing might help. And we blasted him with it for, over the past 4 weeks. 4 10-minute treatments, and his strength is 65% better.
Yeah. I tell you what, there's a lot there with that. And I had a young man who I saw right before college started up, probably about 2.5, 3 weeks before college started this last spring or last fall. And he ended up having an injury to his neck last wrestling season. And so he was a senior, he ended up getting like these herniations in his disc or disc herniations in his neck. And like he was basically out for the season, done. But then like his strength, like his muscles started wasting away, and like his triceps and his pecs and C5, C5, C6, 7 groups were all just started to shrink away, and basically was advised, you can't do baseball, whatever. So he missed out on the wrestling and the baseball season and all this kind of stuff. And he's a young man, 18 years old, was really active, liked to lift weights and do all the stuff, right? And now he's like, I don't know, you're faced with this thing, like, am I gonna have to live with this my rest of my life? Like just being weak and not being able to like really lift heavy or be able to do push-ups, much less, and the nice thing is that his pain had eventually kind of reduced and gone away, but he still had all this muscle waste and weakness. And the awesome thing is that like I knew his dad, and so his dad had him come in, and like I said, leading up right to college, I'm like, let's do this. We're gonna do Shockwave, this is what we're gonna target, and so we targeted those areas from around where his discs were in his neck and his nerve roots areas, and then down in through his traps, and then, or not traps, but like traps, but then in his triceps, and then through his pecs as well too. But we were able to facilitate an improvement. We were able to unlock the box, and that's what is really cool about this. I talk about this is like it's amazing what it works, and when it's done properly and appropriately, it's nothing short of magic. It unlocks Pandora's box, and it starts allow this flow to go back into this connection with the nerves, and to restore the neurophysiologic properties there, where you get an immediate improvement in strength enhancement. So, manual therapy, that we can adjust, we can influence the nervous system. We can improve strength with mobilization or manipulation and things of that nature. We can, manipulate the tone response with those things through the segmental distribution patterns. And so I use my knowledge, rooted in the manual therapy aspect with this technology a lot. So a lot of my treatments are derived from a standpoint of, yes, there's pathological aspect of things in pathology we got to treat, but I also use that neurophys background to help influence and guide my treatments to get the best outcome I can for the patient. And this kid, like I said, in the 2.5, 3 weeks that he was with us before we moved up back to college, he absolutely did fantastic. You could see actually the difference in the size of his pec was starting to come back. The strength certainly was measurably stronger. I think he probably had 65% improvement in strength after just the first session in his triceps, because it was like a week. Maybe we're talking about 3+, 4 out of 5 strength, like pretty weak.
Wow.
Yeah. And so by the time he was done with us, like I couldn't break him anymore. Like it was awesome how quick that turned around within a 3-week period. And he had been suffering with that for 5 months. Yeah. It had been stuck that way since February or so until July. And then within 3 weeks, we flip the script and we get him back to living life again, and he's loving it.
That's really cool.
Yeah.
Is there anything else you wanted to talk about specifically on here about Shockwave, EMTT?
I think for those who are interested in the technology and they're wondering whether or not it could work for you, I'm like, you're obviously you guys know what you're talking about with it, right? These guys know what they're talking about. They're vetted with it. They've been practicing it for a while. And that's the important thing when you're looking at a provider. Make sure they have experience with it and know what they're doing with it.
We go every 6 months to do more and more training on it. And then what's really cool about doing it now, it's been like 2 years since we've been in the world with Curomedics and things. And it's like, it's cool to show up every 6 months and see all the new things that have been being developed just within that 6 months, with the studies, with these key opinion leaders trying, just, especially in Europe, these fuckers are crazy over there with what they'll do. It's like, yeah, open heart surgery, we'll blast it right on the heart. We'll do it on the brain. Like, whatever. Like, we're not doing that stuff over here quite yet.
There's more regulations over here. Yeah.
Yeah. There's a lot more regulation and red tape over here than over there. So, but it's really cool to like show up every time. And like, as frustrating as it can be for a clinician to like not have a direct answer, it's really cool for me to kind of be a part of the experience of like pioneering technology with people, having conversation with you. How are you doing it versus how's this guy doing it? And like, not everyone's in agreement, but there's no heart. Like, we have very promising data on it working. And anecdotally, like in my practice, it's huge. Like over 50% of our patients choose to pay extra to use this technology within their session. But then just to, see how much it continues to change and thoughts are changing on it, and see how much potential there is. And there's so many things they've barely just tapped the surface on, but it's really cool to see like all the different things that are coming from it.
Yeah. And I mean, and so if like you're a patient who is looking at this and do I get this or not? Like we talked about, there's a no lose proposition here.
Yeah.
And when I'm asked sometimes, like, who do you recommend this to? I said, just about everybody.
Yeah. And people ask me, and I'm like, if you want to improve the blood flow to it, decrease inflammation, and regenerate tissue, which is pretty much anyone in pain, you would want to do that unless you have cancer. And even that today was kind of proven to be possibly, we don't know.
We need more data for that. We need more data for that. But the recommendation would be no for that, obviously. But, but there is some potential promising signs, in towards the treatment of those things that they're currently working on in some areas of the world right now. But it's, I mean, so to me, like, do no harm means do not withhold. That's the way I always look at it. And I've had a standpoint of like, as far as like, who do you recommend this to? I said just about everybody, but there's some certain cases where you don't
doesn't fit.
It's not yet. You'll be all right. It's not that big of a thing here going on that like you're talking about like a grade 1 or whatever. It's like, okay, this will be fine by next week on its own. So we don't really need to go into this realm if we don't want to now. But if you're a high level competitive athlete, maybe you don't want to wait 7 days and you want to just wait 4 or whatever. Like, can we kind of speed it up a little bit? Yeah. So the scenarios will change for different reasons, but no lose proposition, especially if you're somebody who is dealing with a good amount of pain, or you're trying to stave off or avoid a surgery, even at the chance that it doesn't work, it's no lose, because at the very least what you're doing is you're prepping the cells, you're fertilizing that area for where the surgery is going to be done. And that means the surgeon's going to have an easier time with the surgery, and your post-op rehab and recovery is going to be so much better and easier because everything has been already basically prepped for healing and recovery.
Do you know too? This is an interesting one actually. With imaging, like, can inflammation blur images for people?
Yeah.
And if you're doing Shockwave before someone goes for, say, an MRI.
Yep. And so that's the thing with that. If somebody's getting an MRI and they've had Shockwave done, and then they have an MRI afterwards, you can have artifact in there that show other things that, like, it can show, like, let's say plantar fascia or an Achilles, right? You go get an MRI on that and you've been doing Shockwave therapy, it's going to show that it's a false positive for, like, there's a tear. It's going to show like that there's something wrong there because you're promoting that healthy inflammatory response, but it's going to almost look on an MRI that there's a tear there, even though there's not a tear there. Okay. And so that's something that you have to inform the doctor who's ordering the MRI of beforehand, hey, they've been going through this. So there's a chance that this stuff could show up, or there could be some things that mimic something like this or similar to this.
Yeah.
Yep.
But could it help clear like the inflammation that's going to cloud an image of what's findings do as far as like what they can and can't see? Because sometimes someone gets imaging done and it's unclear of, is there a tear, is there not? They couldn't see it clearly. Yeah,
I don't know about that.
Yeah,
I guess I can't really speak too much to that, if that's a real thing or not. If it would help. Get some of that out of there. I mean, I think you could maybe theoretically say that I could see maybe how it could help, but like at the end of the day, I don't really have an answer one way or another, and whether or not it would or not. And there's probably somebody out there listening or that may know
probably
the answer to this, but I don't have the answer for that. So despite what you think, Brett, I don't have all the answers.
You got most of them.
I got a lot of good answers, but I don't have all the answers.
Anything else you want to add, my friend?
No, I mean, I think, like, just circling back, it's a great technology. It's completely revolutionized and changed the way that I practice and treat people. Like, going back, if like I were to go like treat without this now, could I get it done? Like
you can,
it would be hard. It would be really hard.
And you feel so this is a great part is, yeah, like it's very hard to not offer this. So I have 2 locations.
Yeah.
One that we have the Shockwave and the EMTT all in our headquarters. Our location that's 55 minutes away does not have it. And a lot of times meniscus tears, radiculopathy stuff. I'm like, a lot of chronic pain. I'm like, hey, you know what? Like, I know it's a drive, but like you will benefit. And I give them a big discount for driving down too. But I'm like, this is going to help you. I want you to come to my other clinic and get this treatment. And I literally I closed that clinic down because I just started sending all the people from that clinic to my other clinic because this device is there and it's what's getting people better. And then we've just gotten busy enough where I don't need that other clinic anymore anyways. And it just made more sense for me to have the one clinic where we're doing all the stuff.
It's really hard for me to envision practicing without this in my toolbox. It's really difficult to not have that now because it's done things that I've never in my wildest dreams thought would happen. You know, I talk about this a little bit with some of my kitchen sink patients. I'll talk about, you know, and sometimes we're an individual, they're not quite ready, and that's fine. You know, all you have to do at the baseline, when they come in and I think that this would be appropriate for them or they would benefit from it, I recommend the option. And it's up to them if they want to decide to do it or not. But at least I know that I at least offered it, right? And some people may not want to do it right away just because of maybe some financial concerns or cost reasons, which is totally cool. But at least they know that it's an option. And so we're 4 weeks down the road and we're not moving the needle. You know, we bring this back up again. And then, you know, these people sound like I don't try. Like we try to get them better without having to do this then. And then sometimes you just can't move the needle. And it's like you throw, like the kitchen sink, you throw everything at them. I've like done everything possible. I'm like, God, this is so stubborn. It's not, we can't move the needle here. Let's go ahead and try it. What do you say? Okay, let's do it. And then you do the first treatment and it's like, they just take off and they go to the moon with it. And they're like, you know, the words that the comments that are often said is like, man, I really wish I would have done this 4 weeks ago. And I'm like, yes, that's what I was trying to say. You know, respectfully, I get it, but like but when that happens, like I just shake my head and I laugh like a little kid. I'm like, I can't believe it because I've literally done everything in my power and I have a big toolbox, you know, with how I approach things and all the different non-invasive conservative treatments you can possibly deliver. And we still can't move the needle on this. We do a treatment of Shockwave with EMTT and oh my God, I just giggle and laugh. I'm like, this is insane. This stuff's crazy. Yeah. But I see that stuff all the time. And so it's like when you know you have that type of power in your toolbox, how could you not want to use it or have it or offer it to your patients? Like, how could I not want to offer my patients the absolute best technology in the world that's out there that's from a non-invasive standpoint? Let's think about this. Surgery is the last end of the road, right? It's here. Below surgery, you have your injections, your orthobiologics, whatever else. Below that, shockwave therapy. It's the next thing you can do from actually the TILUS level thing from a non-invasive standpoint that you could do to help treat and heal the body. That's it. If the shockwave's not working, potentially biologics or an injectable of some sort, or it's surgery. That's the list. Yeah. That's it. And so to be able to do everything from exercise, you know, soft tissue work, whatever, all the way up to freaking short of injections and surgeries. Yeah. Pretty freaking cool, man. It's really cool. Yeah. It's definitely a different viewpoint I practice from now than I did 2 years ago before I started integrating this technology. Yeah. And seeing what we can now do just short of surgery and the other thing too is like there's some studies on like the rotator cuff, the supraspinatus tears, where we show a better outcome with like a 3 millimeter tear getting treated better, having a better outcome with Shockwave than doing the surgery to fully, you know, connect it back together. Yeah. And a healing on its own with Shockwave. Yeah. I was like, you didn't have to go in, you didn't have to risk infection, you didn't have to risk anything with anesthesia. Yep. You didn't have to be out of work for any period of time typically because like you're just going to get sped up faster. So Yeah, the mission with this too, if we go back full circle to what we talked about at the beginning of this podcast, it was like, how did you get involved with it?
Yeah.
It's those ghosts in the graveyard,
Yeah.
in the back of my head, if you will, right? And I confidently can say that we've helped probably over 300 people at this point that I would have, before it being introduced to Shockwave, I would have been confidently surefire, like, this is a surgical case.
Mm-hmm.
Like, in the back of your head is like, you're like, we'll do whatever we can, because they'll send you the PT first before surgery, always, all that kind of stuff. It typically happens. But like, as a PT, you're evaluating this person. You're like, this isn't going to go well. This isn't going to work out, right? But I could confidently say that we've probably seen at least 300 people to this point that we've been able to stop that procedure, where I would have been like, this is probably a surefire surgical case. And then we stop that surgery from happening. So the missions, that's powerful right there.
Yeah.
Think about that. That's pretty huge. That's a really, really cool thing.
Yeah. And I think for me too, the way I sometimes think about things is like, if there's something that helped me, right? So I went to that conference and Brendan did the 8 minutes on my elbow. It was like, I couldn't figure out my elbow. I've had my elbow treated by others. No one else could fix it. This did it. I was like, all right, if this can help me when nothing else helped me, like, I have to get this for my patients.
Yeah.
And it's like seeing all the data and everything too. It's just like, it's a no-brainer on why we would like want to offer something like this.
Yeah, it's just next level. It's just so much deeper. It's so complex, and it's just amazing. It's cool stuff.
Yeah. Well, anyways, Keith, where can people find you if they want to train with you, or do clinical trainings with you? If they want to just come to South Dakota for some reason, or Iowa
reason, or I can come out to your clinic, whatever. If you're
so Keith does do a lot of trainings now with his own. It's your own business that you started.
Business, yeah.
So Keith's training people in Shockwave. Where can people reach out to you for that? And then if people happen to be listening here that are patients that want to be your patient, where do they go for all that?
Yeah, absolutely. So we have, like I mentioned, we have 2 clinics that are one in Sioux City is the main clinic, and then the other one's in Akron, Iowa. But if you want to get in touch with me by phone, would be just call the clinic at 712-560-0460. But if you're wanting to send me a personal message, or you're a clinician or clinical owner that wants to be interested in coming to contact me and learn more about this, or you want me to come out to your guys' place, you can shoot me an email at keith@impactptwellness.com. Again, that's keith@impactptwellness.com. That's probably the best way to get a hold of us. You can check my website out at www.impactptwellness.com. You can direct message us there as well too, through the contact link as well too. But fantastic.
Or just fucking message me and I'll put you in touch with him too.
Message Brett.
Although he sucks at answering his text messages. He actually just realized Connor texted him in August.
That's why I gave them the clinic phone number to call, so that way the message absolutely make sure it gets responded to.
Okay. Don't text him directly. Call his clinic. They'll get him in touch with you. Yep, but anyways, man, I appreciate having you on here.
Yeah, that's great.
It was a great weekend learning from you and all the others. And thanks for coming into my humble abode.
Yeah, thanks for having me.
Sorry the dogs were a little crazy for the first half of that.
Pooches were good, so.
And we crashed the light.
We had some things happening, some chaos, but it was all good.
So appreciate it, man.
Dude, thanks for having me, Brett.
Of course.
84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram, or visit ARKITECTfitness.com. Or if you want to rehab with barbell therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.